Visits to emergency departments in Ontario have skyrocketed over the last 2 decades, and researchers say the number of ER patients suffering from a kind of meth-related condition increased almost 15 times between 2003 and 2020, and they believe most of the cases involve crystal meth. The researchers say many patients who take meth also use opioids and are calling for more resources to address the drug crisis in Canada. So for more on this, I'm joined by Paxton Bach, a clinical assistant professor with the Department of Medicine at the University of British Columbia, who was a co-author on this study. Paxton, thank you so much for joining us today. I imagine what you learned is perhaps not surprising, but deeply concerning.
I think that essentially sums it up, Christina. This is data that supports trends that we've seen in the U.S. and trends that anecdotally we have seen happening on the front lines for many years now. I say that as a physician who works in addiction medicine in Vancouver. These data are really sobering, though. They really demonstrate just soaring rates of presentation to hospital for consequences of methamphetamine use in the last 20 years in a way that is very striking.
Dr. Bach, something that was also part of what you discovered and part of this study is that, of course, the users of meth are quite vulnerable, the homeless population, and at times even one concern is it helps to keep those who are unhoused alert so that others don't attempt to steal their property or their belongings. There's such a greater issue here when it comes to use of these drugs in the unhoused community.
Certainly. I mean, people use stimulants across all socioeconomic classes. So by no means is this something that's limited to people who from homeless or vulnerable backgrounds. But disproportionately, we do see high levels of use amongst people who are structurally vulnerable. I think this study just speaks to the lack of really effective treatments we have for people who use stimulants. Unlike other substance use disorders, we really have a pretty bare toolkit in terms of treatments that we can offer them. But also, it speaks to how much we need to invest into a lot of the upstream drivers that are leading to these increased rates of use and these increased presentations to hospital, such as homelessness and poverty, as you alluded to.
And let's talk about some of those drivers. I mean, the study also showed in the last 5 years, the 5-year period, if I recall, between 2015 and 2020, there's an increase. The pandemic began in 2020. What was happening in the years before that you think led to this increase in usage?
So I think that the other takeaway from these findings is it really contextualizes the current overdose crisis that we're experiencing in North America is very much focused on opioids for a good reason. And many people are dying from opioids specifically, but it's not specifically about opioids. We've seen rising incidents of stimulant use implicated in overdoses all across North America for over a decade, and things have just escalated more in the context of COVID-19 with all the changes that have come about in the pandemic and post-pandemic.
One other question I want to ask you about, and this was something that I learned as well from the study and some of the reporting we've done on it, is when you look at a psychiatric ward, often 50% of the people admitted to short stay are under a meth-induced psychosis. So not only is that concerning for the health and well-being of these people, but of course in terms of the healthcare system, meeting the needs of these people and a potential burden on the system.
Yeah, it's an enormous burden on the system for sure. And these numbers really support that, how dramatic the rise in presentations is being related to crystal meth, especially mental health presentations. It also really demonstrates how little evidence-based interventions we have to offer a lot of these individuals. There's a dramatic need for more research into this area to develop evidence-based tools to treat methamphetamine use disorder. But again, also it really highlights the need to invest in a lot of those structural drivers. Yeah,
and thank you for your study, because as you noted, there needs to be more research and support. Dr. Bach, thank you so much for your time. This is Dr. Paxton Bach, clinical assistant professor with the Department of Medicine at the University of British Columbia. Thank you for your time and for your research, doctor.
Thanks for having us.